Tadi topik apa? Dengan Dr. Nabil tadi topik apa?
Schizophrenia.
Schizophrenia. Okay. Alright. Okay. Alright. So for today's session, kita akan go through topics on common childhood psychiatric disorders. So this is actually an introductory lecture on this particular topic because you have similar topics to be covered during year 5 as well. But maybe during year 5, we'll touch more on the clinical aspect as well as management. So today's session, we'll just go through overview of the disorder, just have some idea what it's like and what are the common presentation and how can we identify those who presented with this problem. And I've given 5 topics for your friends to cover. So hopefully we'll be able to cover all the relevant information for all 5 topics. It's a huge and a broad topics on its own. So each topic still ada and a lot of things to know. But as I said, we'll just go through the overview aspect of it. Just get some idea what it looks like, what it's like sahajalah kan. So don't get too worried. You get maybe 3-4 questions overall for this particular topics in the exam. You might not be able to get a chance to see it in the child psychiatric clinic just yet. So hopefully next year when you going through the actual clinical posting for the psychiatry, then you'll be able to get at least some exposure, some direct face-to-face clinical exposure with this particular group of kids lah. Right. So just before we start, just an overview. So when we talk about childhood psychiatric disorder, most of the time we are dealing with number one, fairly broad population. So we're talking about from newborn, toddler, until early adulthood. And so daripada 0 until 18 years old. So that's what childhood basically from age range perspective. So of course, we divide it further to neonates, toddler, preschooler, early childhood, late childhood, adolescent, late adolescent, early adulthood. And tapi overall, as a group, those are category yang kita panggil as childhood. We are referring that age range as childhood. So childhood group lah. That's number one. Number two, another challenge in understanding childhood disorder is the presentation can be so broad lah. So you get patients presented with developmental disorder, for example, at the early stage of life, and 2, 3 years old, 4, 5. And then you have those presented with academic related problem as their main presenting complaint. And then you have those presented with behavioral problem, and then those presented with emotional problem, and plus those presented with early onset of adult mental health problems. So early onset schizophrenia, early onset depression, early onset bipolar, and plus you might also come across substance related disorder in childhood as well. And so dia punya kategori tu broad lah and heterogeneous in a sense. And if you think about it, kalau kita tengok the first stage of development in childhood tu, a lot of problems tu can be interrelated with other disciplines. And you'll see some overlapping symptoms dengan those that we see in pediatric clinics, and then adolescent clinics, medical problem. And so these are the things that you have to understand so that you can appreciate in which aspects and areas that psychiatry will be involved in childhood related health problem. Okay, another thing that you also need to learn and also need to know, probably to understand more about childhood psychiatric disorders, are what's normal. Okay, and so in a lot of contexts, when we talk about childhood psychiatric disorder, we'll be talking about variant of behavior. Maksudnya, it will manifest in behavior. So, to what extent that behavior is pathological in order to appreciate whether that's benda tu problematic or not problematic, pathological or not pathological. And first you have to observe and understand what's normal first. And so understanding normalcy is important before we understand about pathology. And so sebab tu nak appreciate whatever symptoms yang ada presented with childhood, you have to understand apa yang normal. And when we talk about normal in children, we'll be talking about different form of normalcy in different time contexts. And so what's normal for 2 years old might not be normal anymore for 5. What's normal for 6 might not be suitable to be um, uh, exhibited in patients at the age of 15, 16, 19. And so these are the areas and you also have to have some ideas. And so what you learn in pediatrics and pasal development tu, you have to carry forward during this posting or psychiatric posting next year, or whenever you be in contact with patients with uh, childhood psychiatric presentation. Okay, alright. So that's the introduction. You siapa yang present? Boleh start dulu. Nanti later if there's any questions, kita discuss.
Thank you, Doctor. Okay, let's go to the first common childhood psychiatric disorder, which is the autism spectrum disorder. In short, the ASD is a neurodevelopmental disorder characterized by impairments in communication, behavior, and also social functioning beginning in the childhood. The prevalence of ASD in Malaysia was 1.6 in 1,000 among children of 18 to 36 months of age. Prior to the development of DSM-5, the ASD was previously conceptualized as 5 discrete disorder, which is the autistic disorder, Asperger's disorder, childhood disintegrative disorder, Rare syndrome, and also pervasive developmental disorder not otherwise specified. And now it is known as autism spectrum disorder. Okay, next, as for the etiology of ASD, the etiology of ASD is actually unclear, but it is multifactorial, which includes both genetic vulnerability and also environmental factors. And the risk factors of ASD include the first one is advancing parental age, in which the risk of ASD increases with parental age. For example, maternal age more than 40 years old and also paternal age more than 50 years old. The second risk factor is prematurity, which means babies born before 37 weeks of gestation, but in particular those born less than 33 weeks are at high risk of developing ASD. And the third risk factor is those who have neonatal encephalopathy. And the fourth is genetic risk. Those who have family history of ASD, especially those who are twins and also siblings. And next, as for the screening for ASD, the screening for ASD is important as early detection enables early intervention and better outcomes for the patient. So the most the screening test used is the MCHAT, which is MCHAT. It is a 23-item questionnaire on child behavior and development reported by the parents. It may be used as a screening tool for ASD among children of 18 months and repeat again at 24 months if the child passed the earlier MCHAT.
Where do we do it in chat?
Why do we do?
Where?
Oh, where?
Klinik kesihatan.
Masa
Dekat
bila?
primary center.
When?
When 18 months.
So basically masa they come, when they come for the vaccination lah. So masa apa nama developmental check-up. So sebab tu so that's basically kita punya gatekeeping lah. And so we screen them at 2 points masa assessment at klinik kesihatan. Have you all seen MCHAT? Do you include MCHAT dekat dia punya slides tak?
Ada.
Ada. Okay.
Slide
So
upstairs.
it's basically very simple questionnaire. There's only a few important items that we look at, and so normally we'll do this. So normally the JM dekat KK akan do, and then if there's any raised concern, then the doctors at the KK will assess. And kalau child tu needed further assessment, then that's when they akan refer. So that's probably the reason why kita dapat more and more cases of autism, because kita ada a fairly good screening proses lah. Macam mana orang boleh terlepas?
Dia tak datang for vaccination.
Tapi that's not that common lah kan? Lagi? Ada, betul. Lagi lain? Denial. Lagi? So sometimes we get problem dekat those yang tak undergo health check-up and vaccination dekat klinik kesihatan lah. And those who get it done privately elsewhere. And so normally sometimes these are the groups and sometimes missing lah. Okay, carry on.
Okay, thank you, Doctor. And then MCHAT is maybe used to screen children up until the age of 13 months if the child missed the earlier screening. But regardless of the screening result, children suspected of ASD at any age by their family or other care providers should be referred for evaluation. Other screening tools include the SCQ, which is the Social Communication Questionnaire. It is a parent-rated questionnaire on children for age above 4 years old. And then the other screening tools also include the child behavior checklist, infant toddler checklist, and also parents evaluation of developmental status. Next, we look at the MCHAT. So this is the 23 items MCHAT questionnaire. Next, for the scoring. So there are bold items in the questionnaire, which is called the critical items. And then
Can we just go through some of these critical items, tengok apa yang ditanya, so that you have some ideas what are the screening questions that's relevant.
Back.
Bacakan sikit.
So the yang critical is the first one is alamak.
2, 7, 9, 11, 13.
One. Nombor 2 itu does your child take an interest in other children? Yang nombor 7, does your child ever use his
So
or her
nombor 2 tu apa aspect of development yang kita nak tengok? What are we asking about?
social?
Okay. So kita nak tengok dia punya social development. Sambung.
Lepas tu nombor 7, does your child ever use his or her index finger to point to indicate interest in something. Yang ni use of non-verbal communication.
So at what age budak akan start guna jari telunjuk untuk tunjuk untuk indicate apa yang dia nak?
Nine months.
9 months. Bila kita assess MCHAT?
18 months.
18
months.
18 months. Okay. So dia start around 12 months. Okay. So start around 12 months. By the time dia 18, sepatutnya dia dah jadi part of himself lah. Maksudnya dia dah settle. Ada mungkin yang settle lambat sikit kan. Tapi maksudnya kalau by 18 and still tak pointing fingers, then dia dah problematic. So pointing fingers ni dia important sebab dia indicates a few things. Dia indicate social development, dia indicates communication development, dia indicates reciprocal interaction, and dia indicates joint attention. So these are all kita panggil apa, markers of social emotional development. And so maksudnya kalau dia tak berlaku, basically it's telling us that there's something's not right dengan budak ni punya social emotional development. Okay, sambung.
The third is number 9. Does your child ever bring objects over to you, which means to parents, to show you something?
Yang ni nak assess apa?
That's it. Social.
Ini social communication lah. This is basically the the more advanced kita panggil apa? Social emotional development lah. And so biasanya ni by the time budak umur 30 months and dia dah start develop this lah. Sambung.
Item number 13. Does your child imitate you? For example, if you make a facial, will your child imitate you? Non-verbal communication. And then number 14. Does your child respond to his or her name when you call? Verbal communication. Number 15. If you point a toy across the room, does your child look at it? Ini pun non-verbal communication. This is. Okay. Next. So dah tengok the buat item tadi. Lepas tu, if the child requires referral for further evaluation, if it fulfill the following. Next slide. 2 or more critical items. Ataupun 3 or more of any of the item. Next. That's all for MCHAT. Now let's look at the DSM-5 criteria for diagnosis of ASD.
Okay, apa namanya? Hafiza, pause sekejap, ada consultation je.
Okay.
Okay, carry on. Sambung, Hafiza.
So let's look at the DSM-5 criteria for the diagnosis of ASD.
Saya nak perbetul every time you tulis DSM, untuk DSM-5 you kena guna Arabic numerical 5 yang 5 macam kita tulis dalam buku. Dia ni Latin ke Roman? Yang Roman numbering ni dia sampai DSM-4 saja. So start DSM-5 dia dah tukar kepada 5, yang 5 macam tu lah. Okay. Sambung.
Okay, thank you. The first classification is A, persistent deficit in social communication and social interaction across multiple contexts as manifested by the following, currently or by history. This is generally means the examples they're not so good at social stuff. The first one is deficit in social and emotional reciprocity, ranging, for example,
Dia
from
bukan,
abnormal social.
dia bukan not so good not so good tu macam apa nama, macam tak berapa penyakit sangat. So basically we are looking at, bila kita sebut neurodevelopmental problem, dia kena faham dua benda. Satu, dia mesti problem yang related to, originated from the brain, manifest in development. So that's what neurodevelopmental is. So second, dia mesti relate back dengan dia punya developing stages. So bila neurodevelopmental disorder, dia punya symptoms dia akan manifest through developmental problem. So developmental problem can be dua bentuk. Satu, sama ada dia delay, lambat. Maksudnya kalau benda yang sepatutnya settle at the age of 12, at the age of 3 years old baru dia develop, that is problem lah. So that's delay. And second one, it can also presented dengan abnormality in the quality. And so abnormality in quality tu maybe sometimes dia develop, tapi the quality of development tu is not as expected at the age, at the chronology, comparing to the chronological age lah. And contohnya kalau kita, if you look at autism, there are dua main components, and the first one is social communication, second one is behavior. So the social communication ada dua cabang. And so the first one is communication or interaction, speech lah, basically speech and communication. The second one is social. And so the deficit is basically, number one, dia ada problem dengan speech development. And so speech development tu pula ada dia punya, pembahagian dia further. And so ada, bila kita sebut speech, kita ada verbal, non-verbal. So bila verbal, kita ada apa? Pre-verbal speech. In the verbal speech, vocabulary, joint sentence, syntax, word formation, clarity, numbers of word, usage. And so dia ada banyak dia punya elements and components ada under it. And so dia punya range of deficit can be sama ada delay in all, ataupun delay in all ni maksudnya umur 5 tahun tak boleh cakap langsung. So that's basically means memang dia delay in all domains of communication. Tapi ada juga problem dengan certain problem in certain aspects of the communication. Yang contohnya, pada time umur setahun dia dah boleh bercakap. Dan tapi bila dia masuk umur 2 tahun dia boleh bercakap, tapi dia still tak boleh combine words. And so expected at the age of 2 you can combine at least two words in one sentence. And so dia boleh bercakap, nak, cucu, makan. So can speak. And tapi dia punya quality is not normal sebab ada certain areas yang tak develop. And itu maksud deficit in the social and communication, in particular communication aspect lah. Sebab tu saya sebut tadi, you have to understand apa yang normal, apa yang tak normal, so that you can relate dengan child. Dan sebab apa yang child experience tu, apa yang the child experience tu is a symptom of disorder ke, atau it's a normal variant ke, ataupun it's not. And so you have to gather that first lah. Itu social, itu communication. And then under same domain you have social as well. And so social ni basically you can see melalui apa? Selalu saya tengok 4 benda. Yang pertama eye contact, yang kedua peer interest, yang ketiga sharing, joint attention ataupun reciprocal social interaction, dua hala, komunikasi dua hala, perhubungan dua hala. Nombor 4 play. And so through play pun kita boleh detect sama ada dia punya social development tu normal at par with the chronological age or not. And because different age akan ada different range and level of play. So nanti you all belajar lah. And so umur setahun main macam mana, umur 3 tahun main macam mana, umur 7 tahun main macam mana. So it's not the same. Kalau you can recall, and budak umur setahun dia main seorang-seorang kan, main dia punya whatever items yang dia ada. Umur 7 tahun dia dah boleh start main dengan kawan dengan lebih kompleks. And role play, ada peraturan, dia boleh main games, dia boleh main something yang ada giliran, yang ada menang kalah, yang ada score. And so kalau 7 years old main level 1 years old, that's basically deficit in social domains of development, and which basically one of the criteria daripada DSM-5 criteria for autism. So macam tu you look at it. So you have to understand apa areas yang affected and what are the normal range yang expected at that age, and apa yang anak ni deficit, apa yang this particular child having trouble. Okay, so the second one is behavior. So behavior ni ada 4. And so later nanti you learn deeper lah. And tapi basically you see there are patterns in behavior of children with autism. And so selalunya nak mula ingat, you remember 4 R's lah. And so repetitive behavior and rigidity, restricted interest dengan regulation of sensory problem. And so these are the things yang kita list dalam diagnostic criteria. And tapi you have to know, you have to understand macam mana dia manifest. And each of these are different depending on the child. And so for example, repetitive movement. And so apa repetitive movement yang kita, what do we call repetitive movement? Apa nama lain dia for repetitive movement?
Fidgeting.
Sorry?
Fidgeting kan?
Fidgety tu anxiety. The specific
Stepping
names
tu
for it. Start dengan S.
Stepping.
Stepping.
Yang
Stereotype.
Stereotype behavior ataupun stereotyping. And so any repetitive behavior and yang non purposeful. Contoh dia apa?
Susun.
macam flapping hands.
Flapping hand. Susun tu dia bukan motor movement. Susun tu behavior. And flapping hand, flickering fingers, and closing eyes, tapping on hands, tapping on the head banging. So whatever movement yang repetitive tanpa any specific meaningful purpose. So that's for the child ada purpose lah. Dia nak tenangkan diri ke apa, tapi maksudnya from adult perspective ni dia tak ada specific purpose, so kita panggil repetitive movement. And so maksudnya kalau you nak faham, the DSM give you a guideline. And so maknanya dia punya behavior dia repetitive. Tapi what happen in the child can be different. You have 10 child with autism, 10 might have different stereotype presentation. And ada yang tangan, ada yang kaki, ada yang muka, ada yang jinjit kaki, ada yang lompat, ada yang berpusing. So they are different. Tapi you have to know and whether that's normal or not normal. And so we're looking at something yang repetitive, persistent. Okay. So kalau sekali-sekala kita tak panggil lah, tapi persistent. Okay, and inflexible adherence to routine pun sama juga. And so basically rigidity. And so rigidity ni can occur in various contexts. And makan, pakai, behavior, daily routine, objects, toys. And so basically kita nak looking at pattern of the child yang difficult untuk kita shake ataupun untuk kita tukar. And contohnya dia mungkin kalau contoh dari segi makan, and very specific things that they want and they refuse. And ada yang nak makan roti saja, nak makan mi kuning saja, nak makan pasta saja. Dan kita nak bezakan dengan preference adalah the level of flexibility. And so kalau rigidity tu maksudnya memang kalau setengah parents dia akan kata kalau tak ada lah. Dan kalau dia nak memang kena cari juga. And otherwise sama ada dia tak makan langsung atau dia akan tantrum. And so this is an example. Tapi it can be different. So makan satu contoh je. Dan ada budak yang nak pakai baju yang sama je, nak main toys yang sama saja. Dan ada yang rigid dari segi even roads to the school pun. And kalau selalu every day pergi guna this route, and tapi different time pergi guna different route, dia akan become distressed. And so that's an example lah. Okay, so sama juga hypersensitivity, hyposensitivity to sensory, it can be varied. And contohnya ada yang sensitif dengan sound, ada yang sensitif dengan smell, ada yang sensitif dengan touch, ada yang sensitif dengan bau, rasa, movement, and takut tinggi, takut naik lift. And so kalau in clinical context kita kena explore every single areas. And basically kita nak tengok one or two examples from each of the domains. Okay, carry on.
Doktor, 4R tadi apa Tak sempat.
Repetitive movement, rigidity, restricted interest, regulation of sensory.
Okay, thank you.
Thank you, Dr. Untuk A dengan B dah settle. Lepas tu for class untuk C, symptoms must be present in early developmental period. Until social demands exceed limited capacities or maybe must by learn strategies in later life. Maksudnya the patients they have always been like this or they were like this as a child. The pattern is not acquired. And then for D, the symptoms cause clinically significant impairment in social, occupational or other important areas of current functioning. Lepas tu yang last kali for E, these disturbances are not better explained by intellectual disability or global developmental delay. Intellectual disability and autism spectrum disorder frequently co-occur to make comorbid diagnosis of spectrum disorder and intellectual disability. Social communication should be below that expected for general developmental level. Jangan ayat. So basically untuk class E, basically we want to exclude a more general delay that isn't specific to autism and throughout other diagnoses. So that's all for DSM-5. Then next, for the sign and symptoms of ASD, it is based on age groups of the age groups of each children. So we look into two domains. The first one is social interaction and reciprocal communication behaviors, which includes the spoken language. Language, there will be delay in language delay, absent or delayed response to name being called despite the normal hearing. Then or the and also reduce or absent responsive social smiling. And then for responding to others, there will be absent or delayed response to name being called tadi. And then for interacting with others, there will be reduced or absent awareness of personal space or unusually intolerant of people entering their personal space. And then for eye contact, pointing and gesture, there will be reduced or absent use of gestures and facial expressions to communicate with other people. And the second domain is unusual or restricted interest and or a rigid and repetitive behavior, macam yang Dr. explain tadi. Okay, next, for the history and physical examinations, as for the initial assessment, alamak, sorry, sekejap, ada problem dengan laptop.
Okay, sementara Hafiza sort out dia punya technical issues tu. So basically for any neurodevelopmental problem, autism, ADHD and intellectual disability, our assessment normally will start dengan exploring child tu punya development. And so dia tak sama macam kalau adults, kita akan start dengan history of physical illness, betul tak? So kalau an adult come with depression, kita akan tanya what happened, when did the problem start. And tapi kalau patients yang presented dengan autism ke, ADHD ke, intellectual disability ke, biasanya dia akan presented dengan problem that has been there. It's a long standing issues. Contohnya dia datang sebab anak lambat cakap. Dia datang sebab anak tak tidur malam. Dia datang sebab anak suka mengamuk, tantrum. And so normally we'll start with the assessment dengan daripada conceived history, preconception history, and also pregnancy, delivery, and then we go through the development. And so bila kita go through the development tu, kita akan look into pattern of developmental problem. So developmental domain ada berapa? Bila kita assess development domain ada berapa?
4.
Apa dia?
Gross motor, fine motor,
speech, social.
Okay, alright. Ataupun yang tu itu as per Denver lah kan, kalau you all belajar pediatric as per Denver, tapi generally speaking dia ada 3 areas of development. And so yang pertama physical, yang kedua kognitif, yang ketiga apa? So physical, cognitive, another one?
Social.
Social emotional. And so motor, fine motor, gross motor, semua tu dia duduk bawah cognitive. Okay, so physical ni we're looking at head circumference, weight, and body development lah, and body development. And so cognitive ni kita tengok dia punya cognitive aspect lah. And so kalau besar sikit kita tengok intellectual, dan baca, menulis, mengira. And tapi under cognitive sebenarnya bukan tu saja. And we also look at patients punya ability to look up